in metal on metal. And the standard polyethylene, even in the metal on with the ceramic head, is have higher revision rate. This is in the Australia. Let's move to another continental, to the UK. Very interesting, right? The first rank still be the ceramic on poly. Second is ceramic on ceramic and metal on poly. Very important thing is that metal on metal show a significant higher revision rate to almost 20%. This is a very important information from the diversity data right now. So let's move to see about the trend. What is the popularity of the surgeon? They just choose to use with their patient. Let's start with the United States. In 2009, they still show the metal on metal still have almost 30% of the patient. Metal on metal is almost always at 50% in every registry data. Time change. In United States, in 2014, the number of ceramic on highly costly is increased, but the metal on metal is gone from 30% down to just 1%. Let's see in the UK. It's quite the same. Let's see one by one. The number of ceramic on poly is increasing, and the metal on metal is extremely down and down. Metal on poly is still a standard, 50%. Ceramic on ceramic is a little bit decreased and increase of ceramic on poly in the last 5 years, and metal on metal is down to just another 1%. And it's also shown in the Australia from 10% down to 1%. This is from the Korea, in the Asian country. This is just only one registry data that show the ceramic on ceramic is almost 80% in Korea. So if you want to do the ceramic on ceramic, just go to Korea. Maybe that's the most high incident there. And about for whom, let me see each one by one option. First, start with the hard on hard bearing surface, the metal on metal. After this, Dr. Willow will say just more detail about the metal on metal. Everybody know that this is quite have a long track record. Bigger ball in the bigger head, maybe it's better, but it's no worry about wear and osteolysis because it's metal on metal. And lower list of the material-related complication compared to ceramic, like breakage or squeaking sound. But many concern from metal on metal. It can create a corrosion. It can have a carcinogenic effect. And if the patient have future kidney problem, we just don't know how. We need to remove the metal on metal from our patient. And the metallosis and pseudotumor right now is quite a big problem for all over the world. So my conclusion about the metal on metal, if you want to use it, it's best for if you want to be a unique surgeon, do the metal on metal, and do a unique selected patient with a big size of the female, big size body, and big money, but maybe it's money for nothing. And how you know the renal will be good forever with your patient. And it's not for a surgeon, especially a surgeon like me, for my patient, because it's dropping down in the trend. It's high risk of revision, and there's too many concerns. Maybe my indication to do the metal on metal still be just only in the hip resurfacing arthroplasty if we just want to do that. Let's move to the ceramic on ceramic. There are so many advantages. This is the most lowest wear in all over the bearing option. The hardness can resist the third body wear. It's the bio-inert. It has the base fluid film lubrication. And right now, the ceramic delta can reduce the risk of the fracture down to almost very low right now. And even it wear, it's more biocompatibilities and less inflammatory reaction. This is Dr. Pravisi in CCJR last year. They just show maybe the bearing option have the roles in infection too. Because when they accumulate the case with the metal on poly as the standard, ceramic bearing option, even ceramic on poly or ceramic on ceramic, have lower infection rate. compared to the metal on metal is higher. Why? They just hypothesize that the ALTR reaction can be a media for bacterial growth too. So that's why infection quite more, or maybe it's just the diagnosis is not that clear about metallosis or infection, right? Another study, he still also show that ceramic can reduce the biofilm formation compared to the other bearing surface. How about the concern point of the ceramic on ceramic? First, it's limited use of the liner. You cannot use the elevated rib or anything. It's more expensive. And squeaking sound is not eliminated. Even in the new generation, it still have 3 or 4% of the squeaking sound. It can cause stripe wear if we have impingement, microseparation, or edge loading. And it's quite questionable how to manage if we need to revise the broken ceramic right now. Because the reason for revision of ceramic is the unique one. It's different from the other bearing surface because it's revised earlier and is sensitive to a mechanical problem. So the impingement, squeaking, ceramic rupture, mostly it depends on the surgical technique too. So if you want to do the ceramic on ceramic, just precise to the surgical technique, even how to handling the implant, how to clean, how to placement, how to bang it, and it's quite position sensitive. If you don't have a perfect position, it can cause many concerns. So the conclusion of ceramic on ceramic is you can use in a young active patient. If you be a great surgeon, you always put the implant in the perfect position. You just base with the ceramic on ceramic. And not for if the patient, you cannot correct the fixed deformity and restore the alignment and you're concerned about cost effectiveness, maybe it's still not. Like the patient in the picture, how you get the perfect position in this patient. Let's move to the hard on soft bearing surface, the metal on poly. Right now we know that the highly cross-linked poly can reduce the wear rate compared to conventional. And now we have more than 10 years of the clinical study and it's quite extremely good outcome right now. And they still have concern about even its lower wear, but the smaller particle can produce more biologic reaction and more osteolysis. We just don't know that for in the future. For metal and poly, everybody can use that. It's just for the ordinary patient and surgeon. And you have many friends because more than 50% of the patient and surgeon do the metal on poly. And you still can use, if the patient active, you can use the highly cross-linked. And if the patient non-active, you can use just conventional poly. And maybe it's just not for the, if you are the special one, it's not for the special one, it's for ordinary people, right? And if you're still concerned about the transient corrosion for the big head metal, it still be a problem. And right now, for the ceramic on poly, this is increasing the popularity right now because it still have the PE liner advantage. You have many options. It's not so position sensitive. It have lower wear rate compared to the metal on poly. And right now, the problem about the transient and corrosion or metallosis is decreasing. And from the study, they show the fretting corrosion around the transient. It show better in metal on ceramic case compared to the metal head. Okay, I will just go to the conclusion. Right now for Dr. Truesdale, he's still conclusion that the most important thing about the ceramic head compared to the metal head is about the corrosion. So ceramic on poly is best for the someone in the middle. Ceramic on ceramic and metal on highly cross-linked. And right now the trend of using is increasing. If you just concerned about the transient corrosion, use the ceramic on poly is really good. It's not for, there is no strong advantages. It's cost effective. Maybe it just be in between the metal on poly and on ceramic. And it can reduce, the most important thing is about the problem, but it cannot eliminate the ceramic problem like fracture or concern of other thing of the ceramic for sure. So everything have the option there's too many choice, but what is the real purpose? You need to answer to you and your patient. Thank you.